Following is a repeat show that was previously broadcast on Unity FM.
Assalamu alaikum. Welcome to Parenting Hour. You're tuned into Unity FM 93.5 here in Birmingham. Welcome. Lovely weather we're having, mashallah, although it's got a little bit overcast here in Birmingham at the moment. Welcome also to our Luton listeners tuned in on Inspire FM 105.1, and to anybody that is listening to us on the app or online. Welcome to you also in whatever part of the world that you are in. It's been a beautiful weekend here in Birmingham, mashallah. We couldn't believe the weather. Absolutely unbelievable. I'll introduce my guest today because we're going to talk about early years, but very early years, from the beginning when you find out you're pregnant and what that means to you in relation to the red book that you carry around with you. So we have our resident health visitor with us as usual. Welcome, Alice. Assalamu alaikum.
Welcome, salam, Kathleen. Thank you to the viewers. Good evening.
Good. Yes, indeed. And how was the weekend for you?
It's lovely. It was it's lovely. And we were just looking at the weather earlier, and it's probably going to be a bit showery tomorrow, but then it's going to pick up again. So
isn't it lovely? Everybody has a smile on their face. It was just so beautiful to see it, and I think we're all recharged from that.
3 days off, recharged and ready to go.
It was lovely. Mashallah, usually bank holiday weekends it's raining, but at this time we had that little heat wave, which was wonderful, mashallah. I hope it wasn't too hot today for anybody doing exams, because I know there was a few people doing exams today, and it was a little bit hot still. Hopefully they didn't feel it and they managed to get through the exams, and they will be successful, inshallah.
And I hope it doesn't continue until Ramadan.
Inshallah, hopefully in Ramadan it will be a little bit cooler. Easier, inshallah, especially the first few days, because I think the first few days it's hard to get used to the fasting, and if it's hot as well it can be a bit hard with these long days. So what were you up to at the weekend? Were you doing anything special?
Well, we had a little tour. We went to visit family in London, and on Sunday we were in Bradford, so we were having a bit of and we went to a barbecue yesterday.
Oh, lovely. So it was a busy weekend.
Yes, it was lovely, so running around.
Wonderful. That was really nice indeed. Of course, some of our listeners may have been involved in the Birmingham Marathon on Sunday. Because I know that Team Approachable Parenting were there, which was, mashallah, for the first time for about 20 of us to take part in a marathon. It was a really big achievement for us, alhamdulillah, to finish it. And all of us finished it in good time, alhamdulillah, also, mashallah. Some people running, some people a bit more walking than running. But everybody finished it, which was really good, even in that heat. And it was 23, 24 degrees. Actually, it was 27 on my car when I came back.
Very courageous. Degrees. And how many miles was it, Kathleen?
It's 10K, so 10 kilometres, which I'm not sure how much that is in miles. A nice little journey from Aston all the way to the park to in Edgbaston, and then back again to Aston. So it was really nice, mashallah. They go off in phases, so different runners go at different times, and we were one of the last to leave and start, because I think we were new runners. We were put towards the end, which was a long time hanging around. We had a few hours waiting, and I think that didn't help us standing around waiting for it. But once we got going, we really got into it, and I must say, good dues to Birmingham itself and to everybody involved. It was a lovely event. They had bands playing the whole way around, really motivating us. People were there at every corner. There was the guards there, really trying to motivate us. Come on, you're doing great. You've only got 3 kilometres left or 2 kilometres left. And then the people themselves, mashallah, they were coming out with glasses of water. Their children were coming out with little spray guns. Do you want to spray? This was really, really lovely. Really lovely atmosphere. Wonderful, mashallah. I think next year we need more people out doing this.
That was my next question. Would you do it again?
Yes, definitely. And actually there's one coming up in Spain in October, half term, and they're trying to get some of the girls are organised and trying to get us all to go back again to go and do it. So it is something definitely I would do again, and actually want to keep up even walking now on a more regular basis, because I think it really has helped me being out, and we all need that. We all need to be conscious of our health and conscious of our bones, and walking is really good like that. Even if you're not able to run, you can actually walk, or you can walk. Most of it can run a little bit or walk at all. I should do a little bit of mostly walking, but a little bit of running indeed. So I try to do a bit of quick walking, and I know that way I can keep up a pace, quite a good pace.
And then, did you all manage to stick together?
No, we didn't, because some of the group went and started running. Some of them have done it before and have been practicing, so they were really competitive and wanted to beat their time. Some of the young girls, first time doing it, but they wanted to see how far they got. Some of our colleagues actually are suffering today from aches and pains and can't move in the seats, but I'm not suffering, alhamdulillah, because I took the advice of drinking plenty. I had this cold, which was my worry, that I wouldn't be able to do the best I could because of this cold. But alhamdulillah, did go around, did do well. And then I took in the night time a hot bath with some salts in it. And then after that, sprayed myself down a cold shower, which was really hard. But I knew that, yes, it's supposed to be very good and recommended for muscles, which it did work, alhamdulillah.
Did it?
So, yes, I didn't have the aches and pains like some others had.
Very inspirational, thank you.
Yeah. So I learned that from my daughter, who did a cycling challenge out in Spain, and they were doing 50 kilometres a day cycling, and that was a big challenge up the mountains. And she was saying, be prepared, be sure you get a hot bath and then a cold bath. But I couldn't actually get into a cold bath. I was a bit too weak for that, so I just took the shower and just showered myself down and just took a deep breath for a couple of minutes and showered myself down in a cold shower.
Wow.
Yeah,
Excellent.
so it was good. So any listeners that are tuned in today that would like to comment about what you were doing over the weekend, so maybe you were doing something special, or you were on the Birmingham Marathon, or you were running another marathon somewhere else, or you were doing something different, even if you were not doing something and you were looking after your children, or you've just discovered that you are pregnant or somewhere in pregnancy and you want to know about a red book that we're going to talk about this evening, please do ring us in, and the number is 0121 772 8892. That's 0121 772 8892. Of course, you know already my name is Kathleen, and I'm with you here, and we're both with you here for the next hour, which goes really quickly, as we know, because we've often done shows before, and it goes really, really quickly in that time. And we love talking to people actually about their experiences and sharing things on air. It's a great way of communicating and helping people, indeed. So Alice, before we go into the Red Book, how long have you been a health visitor?
I've been a health visitor, Kathleen, since 2009.
2009, mashallah.
Yeah. So it's nearly 9 years.
And what did you do before that?
Paediatric nursing, school nursing, paediatric nursing. So
lots of experience there.
Yeah, I did a lot of complex care. Yeah, I worked in A&E.
Oh, as well.
Paediatric A&E.
Oh, I don't know if I like that, because I was as a nurse working in A&E indeed, and well, I like midwifery, that you don't know the different challenges. A&E, sometimes you really don't know what's coming through.
You don't know what's coming through,
and it's very stressful.
You are on your toes.
You are
on your toes, and you just got to be ready.
Yeah.
Yeah, and I think that's one of the challenges that really kind of motivated me into taking up that post.
Oh, really? That you wanted to be, you like that?
Yeah.
I think you have to know your personality.
Yeah.
You know, if that's suitable or not for you.
Yeah.
And know what you like.
Yeah.
I suppose paediatric A&E is maybe a little bit different, is it, than ordinary A&E? Or
you don't get as many, so and there's not, but you do. It depends on the time of year. But it can get busy. But you also have the doctors there and the GPs and stuff, and there's quite a few of the nurses there. So we support each other. Yeah, so it's excellent work. Yeah,
it is. It's hard going. I remember being a nurse on call like this in the hospital. We used to take it in rotas in Ireland, so one hospital on call and one not. And when you're on call, sometimes there's not room to move. It is so packed, and then you're putting people on stretcher beds and things like this, which things haven't changed much, because we still hear about the stretcher beds here in the UK.
Yeah,
yeah.
I mean, some areas, yes. But it's changing.
So then you moved into health visiting, and now you are a manager.
Yes.
So tell us a little bit about your role now.
So I manage a team of 24 staff, And I think when I've got a full team, it'll probably be about 26. Majority are health visitors, and we have support workers and we have team admins. So we've just grown in an area that we cover, and it's working well. We've got a new service that we're providing, so Birmingham Forward Steps. And we're working with.
Might have heard about that, but not know what that is, because it's the big changes.
It's a big changes. It's about, and that could be another talk that we could talk about one of the days. But it's just a quick overview that it's partnership between the children's centres, and we've got the NSPCC, and we've got the health visiting service and Spurgeon's, and 2 local children's centres, and delivering a service for under 5s, and it's called Birmingham Forward Steps. So we've been commissioned to do that, yeah.
Wonderful, and that's all across Birmingham, 10 districts.
All through 10 districts, yeah. Currently, you would still have see your health visitor as you're linked with your GP, but it will be changing soon, looking at June, July, when we're going to move geographical. So dependent on what postcode you live in, you will see your health visitor according to your postcode.
Okay, so that's going to be something new for people to get used to.
Yeah.
So all the more that we're talking about the Red Book today, because these things will be maybe changing a little bit, coming from GPs to where will I pick up this, and things in the past.
And I also think, Kathleen, that we get the Red Book. We give the Red Book out quite early on after the birth of the baby, but it's just having the time to go through it, and sometimes you just don't have the capacity, or you don't have the time, you've got a newborn baby. And I think there's a lot of useful information, because it's been reviewed over the past few years so many times, and they're reviewing it again actually, and they're looking at having one online.
Oh, that
so that
good.
might be in the future, but because it's updated so regularly, there's so much useful information in there that health visitors usually tend to go through it. But we're not sure about how useful it is at that point in time. I'm just having a new baby, just under 2 weeks. So I thought, just to start off, what the health visitor's role is, what the Red Book is, and just go through a few of the sections.
I think that would be really good indeed, because especially for first-time mums, they probably mightn't even have heard of it. I'm wondering, what is this Red Book? When am I going to get it? Who's going to give it to me? What's in there? And I remember when I got it the first time I had it for my first child, I was quite good at filling it in. And the health visitor made a comment, "Oh, aren't you good at this?" Which was really lovely to keep. But then over the next few children, that wore off, and I didn't fill it in. So probably
that's quite really common. That is really common. And when you had your second and third child, the Red Book, we don't know where the Red Book is. So that is really common, and you do fill it in, and you complete it, and you take it with you everywhere. But as you have more children, it becomes less common.
So can you explain a bit about the background of the Red Book and when people will get that?
Okay. The Red Book, officially known as the Personal Child Health Record, is a national standard and for health and development. And it's given to parents at the child's birth. So the health visitors usually go out just under 14 days, between 10 to 14 days, and they will go through the Red Book and give it out to the parents. So it's like a red wallety thing, and on the front it says My Personal Child Health Record. There's a different one for girls and there's a different one for boys. Now the reason for that is the girls' ones, the centile charts at the back, they will usually be more framed towards the girls, and the boys' one is framed towards the boys, because boys tend to be heavier and their growth is slightly different. So that's the difference between the girls' centile charts and the boys' centile charts. It's there to encourage partnership between early years practitioners and parents, and to empower parents to oversee the child's health and development. So early years practitioners, it could be when you have your GP appointment, when your nurseries, your health visitor always will complete it, the midwives input, children's centre staff. So it's really good practice to keep it with you, and they can review it and they can plot into it, they can write into it. The health visitor, just to touch on the health visitor's role in this, is that the health visitor can support you and your child up to the age of 5 And we have 5 key contacts. So we start off with antenatal contact, which is just after 28 weeks. Then we visit between the 10 to 14 days. That's the new birth visit. And then when your baby is 6 to 8 weeks old, we review your child's development between 9 to 12 months, and then review again at 2 and 2.5. Health visitors provide the Healthy Child Programme, and there's different elements to the programme. So there's Universal and Universal Plus. So everyone is in the Universal offer of the programme, and which is the 5 contacted visits. Anything above becomes Universal Plus and Universal Partnership Plus. So your health visitor will discuss that with you when they come out to do your new birth visit. So they will discuss the what offer they're providing you, and what additional support you need, and if they think you work with them to have a care plan in place. So I'm just going to start off. So I've got the red book here with me, so I'm going to go through the sectors and then. So right at the beginning, when you've got your child red book, so I refer to it as a red book throughout it, because that's what we refer to
as red book. Doctors. And
you will get everyone referring to it as red book, and parents. You say to parents red book, and they know what you're talking about. So I refer to it as red book rather than the parent-child record, because then that might cause confusion. So right at the beginning, there's child's family birth details and local information, which is completed in the first few weeks of the baby being born. So there's assessments on breastfeeding, bottle feeding. There's checklists on all this. There's also when you have your baby's hearing checked in the hospital, and when they have the BCG, and when the health visitor comes out, she does her assessment. So you've got all that in there. So that's the first section of the red book. Then we move on to the next section, which is information and advice. Now, we're going to go into a lot of this, so I'll just open it. So the first page on here, it's about safe sleep. Now, if you've had a baby recently, or you've had a baby in the last few years, you've had a health visitor come out, and we've talked about safe sleep. And this is to reduce the risk of sudden infant death syndrome.
Okay, yes. We need to be very careful of that. Yeah. That's on the rise, isn't it?
Yeah, so we always talk about, encourage parents on what to do. Now, in regards to this, safe sleeping, right at the front, the first page of the Red Book, just behind the front cover, there's a do and don'ts. So there's little picture diagrams, Kathleen, which says this is how you place your baby, this is where you put your baby, and this is what you don't do. So I'll just touch on those rather than go through the checklist. So always place your baby on their back and sleep. Place your baby to sleep in a separate cot or Moses basket in the same room as you for the first 6 months. Breastfeed your baby if you can.
Yeah.
The don'ts are never sleep on a sofa or armchair with your baby. Don't sleep in the same bed as your baby if you smoke, drink or take drugs. So we don't recommend co-sleeping at all, but especially if you smoke, drink or take drugs. Keep your baby smoke-free during pregnancy and after birth. And don't cover your baby face or head. So, when we wrap babies round and the blankets and we put little hats on and think your baby's cold.
During that snow time there, when it was really cold, people were thinking, oh, maybe my baby's a bit cold. I wrapped them up a little bit more. So that's not something recommended, of course, to do.
And if you decide to co-sleep with your baby, do discuss it with your midwife, your GP, your health visitor, and let them know so they can go through it with you and discuss it, how to make it safer.
Okay.
So there's also an assessment on this, so the health visitor can work with you on this, on the safe sleep assessment. So I'm moving on to the next page, which is Start for Life. So when you have a new baby, things change. And as a parent, you get lots of questions, and you don't have someone always. So as a society, we're moving on for work purposes. People are geographically moving around the country. You don't have the same support systems sometimes that you usually would with your family. So if you need more information, there's lots of services available, and Start for Life is a government initiative, and it's got lots of video clips, practical advice, and people giving their own experiences. So both mom and dads can sign up and receive regular emails and videos, and they can also get SMS messages, which is excellent, and latest things. So you can sign up for Start for Life, information for parents, on www.nhs.uk/Start4Life/pages and /healthy pregnancy baby advice. And there's lots of advice on there, from having your baby, from weaning, immunisations, breastfeeding. So if you just want to recap, what did my health visitor say, or what did my midwife say, you can always go back and recap on that, which is excellent. I'm going to move on now to NHS Choices. NHS Choices is a health website providing information on all aspects of child and family health. This includes being a new parent, birth to 5 development, immunisations, healthy eating, childhood illnesses and child safety. There's also videos on this one as well. And again, this is www.nhs.uk. What we always reinforce to parents is who to call when there's an emergency, because sometimes you're not sure, do I need to call an ambulance? Do I need to call out of our doctor? Do I need to call the NHS? What number do I need to call? So there's lots of numbers that you call, and it's all in the Red Book. So do go through the Red Book, and it's easy to follow instructions on what you need to do, or I won't go through all of it, but there is quite, there's a lot of information.
It's quite in depth there, what you need to do. So it's not just something to give to you to put in the drawer and things like that and take out at visits. It's something that lots of information that parents should know about. And maybe they could actually either take a picture of those numbers and have them in the phone if they need it, or have it somewhere up on the
111. We always recommend 111, and you've got advisors at the end of the line, and they can always discuss things with you.
So that's 1111.
111.
So if you're worried about anything, you pick up the phone and ring that, and the advisors. And is that 24 hours?
That's 24 hours.
And that's really good service.
So if you need any medical help fast, but it's not a 999 emergency. You don't know whether to call for medical help, or you don't have the answers. Sorry. Or you think you need to go to A&E or another NHS urgent care centre, or you require health information or reassurance, then you can call 111 and they can advise you.
Okay. So that's good advice. I mean, if there's an emergency, you go straight away to either your A&E or ring an ambulance straight away. So something that you're worried about the child's colour, or you think that they might have swallowed something, or things like that, or they have this rash that you don't know what it is. They're very poorly in high temperature, and things that they may be fitting and things like that. These are all emergency cases. And
I would also recommend, if you've got a family who's recently moved out from another country and they'd speak limited English, we do go out and we do discuss the emergency services, 999, 111. But do let them know in conversations, if you can speak the same language, just pop it on, do you know if there's an emergency, this is a number, because it's a matter of life and death. It can save a life if they're not sure. And it's amazing, we've been out to so many that they wouldn't know who to call in an emergency. So
that's a shame, isn't it, that we have communities that don't know this, and there we have such great services here, but they might never have known this because they might not be used to it in their own country. So to come here to know that you have an online service like this, or you can talk. Is there interpreters on 111?
I'm sure they can arrange that as well. So
if you're worried, that it would be something good to have indeed. So all this information, of course, if they ring beforehand, it's all preparation, isn't it?
It is,
It's like doing exams, if you fail to prepare, you prepare. What's the saying? Fail to prepare, prepare to fail.
Prepare to fail.
Yes, and parenting is similar too. You need to prepare and think about it, and be thinking of, okay, what will I do if this happens? Especially if you're in a new country, don't speak language, or if you are a mum in the new country and sometimes you're alone in the house and your husband does speak, but he's busy at work and he might be able to get to you when you need him to get to you. You need these numbers at hand.
These numbers, and everyone knows knows how to dial, so they can dial the numbers in an emergency, and even if they just say there's an emergency, because some countries, they don't have an emergency system, as in when an ambulance would come out, they would actually drive to the hospital themselves. So so if you can imagine waiting for a taxi, if that's there, or if you're waiting for a car or a lift, and that's postponing the medical need for that person or that child.
And we do need to get this message across, because we know that our families are suffering more than other families. So when it's talking about families that are maybe dying prematurely, things like that, and we look at the Muslim community statistics, we're quite high compared to the non-Muslim statistics. So I think it is some things like this, information, languages, that we need to improve on to be able to get it there, and encourage our listeners to do so. Listeners, you're tuned into Unity FM 93.5. We're on Parenting Hour. We're here with you until 6 o'clock. We're just coming up to a commercial break, and we're talking about the Red Book this evening with our resident health visitor, Alice, who's often come in before to the studio and talk to us about different things. Now, you might not have known the importance of this Red Book, but if you want to ask us any questions about this, or ask her any other questions, do ring in on 0121 772 8892 as we go into this commercial break. Join us afterwards, inshallah, with your questions. Assalamu alaikum, listeners. Welcome to Parenting Hour. You're tuned into Unity FM 93.5 here in Birmingham, and also tuned in to us in Luton on 105.1. Hope, inshallah, you're all having a great evening, afternoon, wherever you are, inshallah, and that you've enjoyed the weekend and you had a good day today. Alhamdulillah, the sun was lovely today, inshallah. I know the children are more energetic when they see the sun, mashallah, and it's like as if they're growing in front of you. The way they blossom and grow with this sunshine, mashallah, it's lovely to see spring coming in. We're talking a bit about that today, growth, really, but from babies, and how they grow so quickly, and why we need the Red Book to keep a note of this, and how that can help us if there's an emergencies. So this evening we've been talking about this already in the studio with our resident health visitor, Alice, and she's back again with us. Assalamu alaikum, Alice.
Welcome, salam.
We're here Kathleen for the second half of the show, indeed, inshallah. Listeners, if you want to ring in and join in the conversation, we'd love to hear you. You're welcome to. I think you know the number by now. It's 0121 772 8892. Of course, if you have a question that you'd like to ask Alice in private, please do ring in and leave your number. We can get back to you after the show. Or you can email studio@unityfm.net, and the manager will pass over that email to us, and we can pass it on to Alice, indeed, and get back to you with the correct information. So, Alice, before the break there, we were talking quite a bit about the Red Book, and we were saying that people sometimes just shove it in the drawers and forget all about it, but actually there's a lot in there, a lot of contact numbers, especially for parents to know if they're new to the country, if they don't speak the language. Maybe people listening in today know of somebody that actually has had a baby recently that doesn't speak English, that are quite new to the UK, and they now, from listening to this show, may actually pick up the phone tonight and have a conversation with them and explain a bit more about the Red Book, so that they would be able to understand what are the uses of this. Wouldn't that be good?
Yeah, that would be excellent. And health visitors do go out, and we do discuss it. We do take an interpreter with us. But if it's what the issue might be, that how much do you take in when you've just had a baby, at 2 weeks. So there's a lot of information in there, and you might not just get all of it. And if you can imagine, you've got an interpreter there, and that takes even longer. So it's just how much can you really absorb. So I don't know when parents might, how long they can continue concentrating. So if you do know a parent, and you could always say, I'm happy to read through it with you. A lot of mums usually say, I'll ask Dad to read it with me again, and
that's great. And they need to be involved right from the beginning.
And if it's your second or third child, do go through your Red Book again, because things have changed. The Red Book has been reviewed quite often in the last few years, and things are updated. So things might be different to what they were a couple of years back when you had your first or second baby. So
So lots of information there for us all to know and help each other. Indeed. Oh, do you hear that little bird singing outside? What a lovely tune, indeed, in this lovely evening here in Birmingham. I'm sure our listeners can hear it also, because the windows are wide open here in the studio with the hot day it is. And something I always like is birds, mashallah. I love them waking up in the morning.
And listening to them.
But maybe a new mum might not like them very much, and she's trying to get back to sleep again, and the birds are keeping her awake.
Yeah.
It is true that that mums, trying to take it all in at 2 weeks, it's a bit early, especially if you're very tired, if you're alone, even if it's not your first child, because some cultures, they would stay at home for 40 days or would have mother-in-law there, and maybe come to the UK and don't have that support system, don't have mother-in-law or mother there to help, haven't still formed friends, so they're quite alone. I don't know the neighbours, and it's quite difficult if that happens.
It's quite difficult. There are support groups, and health visitors sometimes run support groups. Children's centres run support groups. So if you know of someone who you might think they could do with a bit more support, they've got limited contact, because that's one of the questions we do ask: have you got support systems in place when we go out? And if they say they've got limited support, we always signpost them to the local children's centre, or we do additional contact visits. We get our support staff to go out and support them a bit more, just to go through things a bit more, because they just need that bit extra support. You can imagine having a new baby, being in a new country, so so
and we want to prevent all the things that we hear about on the headlines of the newspaper, of either something tragic that has happened, or something has gone wrong because parents haven't gone quick enough to the hospital, or don't know when it's emergency, don't know who to contact.
We had a case not long ago where a child had an asthma attack, and parents thought that it's probably quicker to take them into hospital. But unfortunately the child didn't make it, and and the ambulance, they said that the hospital and everything was queried as to why the ambulance wasn't called, because they can actually blue light them in, so they can have their sirens on, and so it is in emergencies it is birth, unless you're across the road and carrying them across the road to a hospital, but what are the chances of that? So you really need to think about.
Really difficult, actually, really hard.
Very difficult,
especially young children. All children, they can go downhill very quickly enough, but babies, they're so small. Actually, a few minutes makes a difference. It's not like adults that you do have that bit of time. It is with children; it's very quick.
It is. It does. It makes a lot of difference.
So this is why this red book is so important, with those numbers there, that parents know who they can ring, for what reason, and when, etc. So before the break, you were explaining quite a bit in the red book. I think you were going to go through a few more concepts now, so that we can help parents understand a bit more.
If your child's on any medication, there's a page in the red book about medicines for children and reliable information. I'm not going to go through it, but just to
page number,
it's page 19. But this version, this red book version, is August 2017. So if you've got any ones that are made earlier, it might be slightly different. So always report side effects to the medicine safety watchdog if your child's had a reaction, which I think a lot of parents don't know about. So that's a yellow card scheme, and you can Google it, and you can also find it on www.mhra.gov.uk. So if your child has regular medication, or they've just had a one-off medication, they've had a reaction, always, because it's important for the research and the evidence base, because we don't want it to happen again to another child, and it needs to be in the leaflet informing parents that this might be a side effect.
Of course.
So that's quite important.
Putting on the child's records as well, so that
and the hospital, and that's safety for the child as well. So in the future, if they've ever had surgery, or if they've taken the GP or the health visitors, always ask you, does your child have any allergies? And then you can say yes, they've had an allergy from this.
Great, that's good advice.
Okay, the next one is helping your child learn and develop. Health visitors will usually go out in Birmingham with a book pack. So your book start bag, you've got lots of books in there and some literature. The whole aim is that parents and carers sometimes underestimate what they can do to support their child's development. So everything you do with your child at home is important in supporting their learning and development.
Oh, definitely. We support that so much.
Yeah.
You know, we're
talking
up our road.
and reading stories to babies and young children helps them to learn and understand new words and ideas, and they respond differently. iPads, television, we definitely discourage. Child's too young, who's censoring the iPad and YouTube. You don't know what can go on there, so you really phones as well, so not just iPads. Children shouldn't really be having access to iPads, phones, and TV should be very limited.
Exactly, because indeed, everything we need to put it into concept, because this is the most important time for brain development. Crucial. 1001, they say, critical days. And every second, imagine every second, not just every minute, but the brain is developing every second. So parents need to be aware of this and what they're doing, and as you're mentioning there, which is good, reading stories, reading Quran, talking to them, playing with them, stroking, cuddling, all of this is helping brain development. And that is more important, to get that right now in that early stage. Believe me, listeners, you will not be coming to us in the teenage years if you get this right now. If you get to conform that bonding, that secure attachment, get that brain development right in the early days, the teenage years will be much easier for you. And I think we're still trying to get that message across, because people think, oh, they're only babies. What are they doing? All you need to do is pick them up, feed them, change their nappy, put them back down again. But that's not quite correct. We
underestimate their learning of us all the time. How we speak to them, how we listen to them. So how we act in front of them. So babies are very clever, so they do pick up on these things. Just to move on, early education, childcare. I'm not going to go into it, but if you need more information on childcare, and if you can access funding, so see if you're eligible to get funding, just go onto the website or www.gov.uk/help with childcare costs, and this you can work out if you're eligible for free childcare.
Okay, that's really good to give the website, because they keep changing these things, and the eligibility and who can get it and from what age, etc. Of course, local children's centres would be able to help.
Local children's centres, health visitors, just ask them for more information.
And I don't know if also, this is something that I wasn't aware of. And I spoke English, but I came from Ireland. We didn't have this system in Ireland of childcare. I came from the countryside in Ireland. There was no such thing as childcare. So I think a lot of people coming from other countries abroad would not be used to this system where we have free childcare depending on the age, of course, for children, and parents can avail of this. So it's worthwhile asking and finding out.
Next, I'm going to move on to, I've got two charities, Contact a Family. So this is for families who've got children with disabled children. And you can access the free helpline. They link families. They've got lots of publications, medical information, and they also offer one-to-one support. So Contact a Family, you can either Google them, or you can give them a ring on 0207 608 8700. Second one is Family Lives, which is another charity, and this is all in your red book, and they've got experience in helping parentality with changes that are a constant part of family. So they help families with active roles in their raising their children, and mums and dads and grandparents and step parents. So if you would like their contact details, if you Google familylives.org.uk, or if you would need their number, it's 0808 800 2222, and they offer a lot of support as well. Now we're moving on to infant feeding. a few years back, we used to give, even last year, we used to give lots of leaflets to parents when we used to go out and do the new birth visit. Unfortunately, we get a lot of funding pulled out, so you don't get all those glossy little leaflets anymore. We do try to print off as much as we can, but we always refer back to, because we don't want to be duplicating as well. We've got to think of the environment as well. And I think it's being quite cautious. So they've really done, I think, an excellent job. They've added most of the infant feeding websites onto the Red Book, so you can access them on the internet in your own time. However, if parents haven't got internet access, or if a language is an issue, then Health Visitors always have spare copies and we can hand them out. So always do ask. So infant feeding, there's lots of websites there on one of the pages. So I would really recommend that you go through them. Next, we've got Vitamins and Healthy Start. So in Birmingham, so you know that we offer the Healthy Start vitamins to all our children. In other areas, it's slightly different. So free Healthy Start vitamins containing vitamin D are available for women from confirmation of pregnancy until the child reaches 12 months, and all babies and children from 4 weeks until their 4th birthday. And this is part of the Birmingham Vitamin D scheme and campaign. So you can pick these up at the health visitors usually go out on the new birth visit, and they will give you some drops, and they will have some tablets for the moms, and then 6 to 8 week checks. You will also have this at clinics. So when you go to the baby clinics at the GP surgeries or the children's centres, they always have a stock there, so you can pick some up, or you can pick some up at the children's centres. So you're always accessible the vitamins to pick up from.
Of course, that's really important with vitamins, and for parents, they might pick up some of their vitamin D now with this lovely sunshine as well. I'm going to be talking about sun exposure, which I thought was quite important, and I know we're running out of time, so I really want to get into that. But healthy teeth, so there's a page on healthy teeth and how to look after your child, and you can register with a dentist soon after the birth, because they have so many waiting lists, and you can start brushing your baby's teeth as they appear with a soft brush, and we've done a program on this previously with a dentist, and if there is demand, if for any of this information that I'm going through, if you would like me to go more deeper and bring a specialist on regarding this, then please give us a call, and I can arrange someone to come in. I can do a program, even if it's a repeat, we can go through it again, because I think it's such useful information that you can never really get enough of. There's always people moving around, and maybe people that haven't heard it before. So if you don't know the number, listeners, it is 0121 772 8892. You can ring in now if you have a query, or ring in later on if you want to know something else or some information, or you can email studio@unityfm.net.
Okay. Home safety. We know how important home safety is, Kathleen. And
I don't know if you can ever keep home 100% safe, because things happen. Things happen. Human beings living there, so things get moved around. You might have thought that things were very safe, and then all of a sudden there's something moved not in this place. Yeah, which I found recently. I think one of my sons leaving the plug in with the iron, so he's switching it off, but he's leaving the plug in, which has always been a no-no. You always take it out of the socket, so that needs to be picked up in my house. Definitely. Only this morning, one of our parents from London sent us a picture of a house on fire, and it was from a candle that was left on. So we have to be very, very careful. Very, very careful. And sometimes with children, as they get older, so as teenagers, they might forget or think, it's okay, switches off. But it just takes someone to put the switch on accidentally. So we have to just be so careful. Definitely, and make sure that things are away from water and electricity. Water don't mix, and all these things, very, very important things to be. There's a lot of safety measures in the house, really, and no parents get a safety course. No. Which I don't think we could bring in something anyway. Even if we were to bring it in, how could you give a safety course around that? But maybe, like if you're at work, you have to go on safety courses. There might be some things to come in the future where parents, as part of their caring for their children and understanding what to do, have some sort of quick tips on safety and health and safety in the home.
And I think a good start is the Red Book, because this in the book, I'm not sure if you can see, we've got 3 excellent pages of 3.
There's pictures there.
There's pictures there, and it's split into 3 pages with different age groups. So how your house should look like for a child who's 0 to 12 months, and then from 1 to 2 years, and then from 3 years. So for each room, he's giving you tips on what you should be looking out for. So it's something that we could explore further at another one of your shows, and probably get someone from Rosper, because they do a lot of work with home safety and child safety, and I think it's really important to kind of relay that message. So probably one of your future shows we will bring someone in. So you've got a brilliant 3 pages of pictures and what you should be looking out for. Next, we always mention this, keeping your child safe in car seats. Putting your seatbelts on.
But we need to mention this more, because I am surprised how many times I have seen children, I'm sorry, listeners, to say, but not in the proper car seats, maybe even not in car seats at all. I've seen people driving around and their children are loose in the back and not even strapped in. So I don't think we can never repeat this enough about the safety of this. And we have a responsibility. Every one of us have responsibility to keep children safe. And parents have a bigger responsibility, because it's their responsibility to make sure their children are kept safe. And these regulations are not made to push us out or to think as a hardship on us. These are made for us to help our children, to make sure that they stay safe. Have you come across it, Alice? Have you seen children hanging out the window, especially fine day, the window down, and their arms out and their heads sticking out?
As I said earlier, we were driving to London, and there was a child who had, and this was on the motorway, had the hand and arm out of the window. Now, I'm not sure if they had the car seat on or the seatbelt on, but even that safety of having your arm out,
All it takes is a lorry or car to drive too close to you, and what would happen then? We need to be thinking of, what if this happens, what will happen? So thinking of that first, and putting safety measures in place to protect your family.
Yeah, I would definitely agree. Now I'm going to move on to in your Red Book you've got bits on babies crying and what to do, so I'm not going to go through that, but you've got a page on meningitis. So we've had a campaign on meningitis and signs to look out for, so what sort of spots. There's a beautiful little baby and pictures, and it tells you what to look out for. So and there's also a helpline as well. So if you have a look at this page, it's towards the middle, and in the old books it's right at the back. So the back page cover, and there's a little picture card there, and you can just go through it, and if you're suspecting anything, please do go to A&E. Now, sun safety as the sun's out, just a quick few points. Spending time in the shade between 11 and 3 for the babies. Make sure you never burn. Aim to cover up with a t-shirt, hat and sunglasses. Remember to take extra care with the children, and the use of 15+ sunscreen. Now, if you've got children under 6 months old, keep them out of direct sunlight, especially in the middle of the day.
And I think, that even at 11 o'clock, it was really hot at the weekend at 11 o'clock. I couldn't go out. I had to come in. And I couldn't actually go out again on it until it was about 5 p.m. Wow. So you're saying a bit earlier 3, but I couldn't make it until 5.
And it's really important that we keep them hydrated. Lots and lots of fluids, preferably water. They don't need sugary sweet drinks. Just lots of lovely. It affects their teeth, and we know that when water's digested, it's digested differently. When sugary drinks are digested, there's extra pressure on their kidneys. So just give them plain water, and that's fine. So just keep them hydrated and lots of water. Right. So the final section, we're running out of time, is section on immunisations and the book start, which we should roughly touch on growth. So immunisation sections, you've got all your immunisation schedule in there. I'm not going to go through that, but if you've got any questions, speak to your health visitor. And it tells you every time you go in, take your book with you, and the practice nurse, when she gives the injection, she will sign your book to say that your baby's had that injection. So growth and development, I think we get a lot of questions from that. So when you have growth and development, you've got it looks a bit complicated, but once you get the hang of it, you'll probably find studying the progress slightly addictive. So every time your baby's weighed and measured, they'll get a little X on the growth chart, or they get a little dot, weight and head circumference, and they're different charts for boys and girls, as mentioned, and premature babies. And this will show how they compare to the average baby of the same age. So what are centile charts? So the chart is divided into centiles, which are basically just a way of comparing your baby to others. So if your baby is on the 25th centile, so usually health visitors will explain this. So if you're number 25 for weight and the height is the 50th centile, it means that if you lined up 100 babies from lightest to heavy, your baby would be number 25. 24 would be lighter and 75 would be heavier. And for height, your baby would be number 50, just in the middle. So with 49 shorter and 50 taller. So that's what centile charts mean.
Okay.
So all children are different, and really doesn't matter which centile your child is on. All the professions are looking for that it's a steady growth and roughly around the same centile as they grow up. So there's no big fluctuations going up and down. So it's a steady flow. Sometimes they can fluctuate between a couple of centiles up and down. And your health visitor will discuss that with you. But that can be quite normal depending on their growth and development. If they've been ill, sometimes they've had diarrhea and vomiting, or they've been poorly, and so they're not as hydrated. So that can happen.
Do you have parents worried when they are not reaching that 25th centile and thinking, oh no, my child is not achieving, they need to be...
Some parents think that their child should be in the 100th centile, so we have to explain that actually what the 100th centile means. It doesn't mean that you have to aim for that. It means that if they were born at so with the starts are from 0.2, so if they were born at 0.2, it doesn't mean that there's any issues. As long as they stay around that in 0.2, slightly up and down, that's fine. You're not aiming to get them at 100.
Brilliant. So you're aiming so that they grow and develop. Well, you've done that really well, Alice. I'm really impressed.
Thank you, Kathleen.
Well,
it was like a race.
It was a race, yes, indeed. So I had my race at the weekend, and you had your race today on the radio show to try and cover the whole of this. But you've gone through the Red Book very quickly. I know we'll go through it bit by bit over the next few months and things like that, so parents can understand it a bit more. Maybe if they want a certain session on it, if they ring us in on 0121 772 8892, we can go into that in a bit more in depth, inshallah. We have coming up for you the next few weeks, listeners, lots of lovely shows. We've got fostering next week, so please tune into that because it's fostering week, and that's on Tuesday between 5 and 6 p.m. on Parenting Hour, where we're going to be talking about fostering. Then of course we're into Ramadan, but we still continue here on Parenting Hour. We're going to be talking about with the NSPCC the following week, and then after that we have breastfeeding. So we've lots of lovely shows linking into today's topic and the importance of that. Thank you, Alice, for coming in today.
You're welcome.
For giving up your time.
Thank you.
And for rearranging everything to make sure you were here to our listeners. It's always a pleasure seeing you. Inshallah, we'll see you soon again. And listeners, inshallah, we'll see you next week. And do tune into Parenting Hour and do dua for us in Ramadan, inshallah. Assalamu alaikum.